All right. Okay. So give me a thumbs up that you guys can see this. All right, very good. All right. So welcome to taking the Blu Poo challenge. Okay. So most of you guys know this. Um, but for anybody watching, so my name is Tracy Burkdahl. I am a family nurse practitioner. I am a muscle testing practitioner, certified in 5 different techniques, specifically something called quantum nutrition testing, nutrition response testing, and synergy or cell core muscle testing practitioner as well. Okay, so this is the Blu Poo challenge. So we want to find out like what your gut microbiome is. Why is this challenge so important for you? But first off, you have to understand what is the gut microbiome. The gut microbiome is actually composed of several different organisms. We need these organisms. So archaea, these are single-celled organisms that play an important role in food digestion and metabolism. The role isn't exactly clear, even though it can play an important part in digestion and metabolism, but like specifically, we're not quite sure. But it is seen in healthy persons who have healthy digestive flora. Bacteria, protists, virus, and fungi. The fungi that we normally see are non-pathogenic, but in certain circumstances, they can become disease-forming pathogens, and we're going to get to that in just a little bit. Okay. So what does the microbiome do? Well, first thing, diversity is the key. We're born with a certain amount of bacteria, fungi, and other microorganisms, and collectively, these are known as the microbiota. Microbiota actually helps in food digestion. We need certain bacteria, we need a certain amount, we need these things for our bodies to function properly. This plays a key role in our immune system, such as fighting colon cancer, the development of white blood cells. We need the gut to function properly. As we grow older, the amount and the different types of these organisms should grow. The more diverse and the more types of these organisms we have, the healthier our gut actually is. One of the things that I want to mention is, so people, you know how women typically, and this might be kind of sound gross or whatnot, but when women have babies, they actually have a bowel movement. That bowel movement is actually a key component to newborns actually developing a healthy gut microbiome. And a lot of times what happens is nurses and doctors want to wipe all that away. But actually that helps to start the immune system of newborn infants. And it helps to provide diversity within the baby. So people are like all this anti-germ and anti-thing. Actually, the more exposed we get to certain germs, the healthier our immune system is to fighting infection. It's nature's design to help the baby. Without the proper gut microbiome, again, food cannot be broken down, and we cannot absorb nutrients as well as we normally would from the foods that we eat, which means that we are left more nutritionally deficient than we already are. Because let's face it, our food supply, especially in the US, is not exactly the best. Without proper gut balance, this can actually cause apoptosis, which is the breakdown of colon cancer cells. Okay, so we need, again, good gut microbiome. They help with other things like the immune system. It helps develop white blood cells, specifically lymphocytes. These lymphocytes help to fight illness and infection. So if our gut is not properly balanced, we cannot develop proper lymphocytes, which also then means that we are more likely to get sick. So, in turn, a healthy immune system also helps to support a healthy gut. They balance each other out. The gut microbiome also has a lot of other things to with inflammation. It helps with colitis, Crohn's disease, and even arthritis, and a lot of other inflammatory diseases, such as rheumatoid arthritis as well, multiple sclerosis, and even more. The gut is also linked to mental health. We know that there's a gut-brain balance in Eastern medicine. They already knew this way back when. They knew that your gut was your second brain. In Western medicine, we're just starting to catch up with that. And actually, I was at a health talk and it was for CEUs. It was a couple years ago. As a nurse practitioner, I have to go get continuing education. And it was about gut health and about gut diversity and about having proper amount of good bacteria and bad bacteria and all these other things. And they were talking about like some medications and what happens when your gut gets imbalanced. And they were telling people, all the participants who were nurses, nurse practitioners, physicians, PAs, physician assistants, and they were talking about, how there's more serotonin, which is your happy hormones, your happy neurotransmitters. There's more serotonin receptor sites in the gut than there actually is in the brain. So if your gut is imbalanced, you can develop things like depression, anxiety, and things like that. And so it was very quite interesting. They were like, well, we can do a fecal test and we can find out like how much bad bacteria is in the gut. And if there's a lot of bad bacteria, we can give you a prescription and this prescription will kill off the bad bacteria. And what's nice is that if it keeps showing up, you can keep giving this prescription. And supposedly that you don't develop, a drug tolerance to it, which means that the bacteria will still respond to this antibiotic. Because I'm sure you've heard that if you don't finish your antibiotics, that you can wind up developing superbugs and then the antibiotic doesn't work anymore. Well, supposedly with this one medication, that was not the case. So there's me, probably one of the only holistic practitioners there, who's also a nurse practitioner. I kind of raised my hand. I said, okay, that sounds great and stuff, but why are we not talking about the underlying causes? And they're just like, well, what do you mean? I'm like, well, diet. We're going to get into this in a minute. And they kind of laughed at me. They said, oh, yeah, diet does play a key in this, but most people don't want to change their diet. So it's just easier to give them a pill. Okay. Said, all right. So let's not fix the cause and the root cause, and let's not educate people and really work with them on their diets. Let's just give them pills and medications. Makes sense to me, so that way they can keep coming back. But mental health and diversity is really important for things like memory, Alzheimer's prevention, anxiety, depression, even your sleep, and things like that. Right. So the gut does a lot of different things. What causes gut microbiome imbalance? Well, this is also known as dysbiosis, which is an imbalance of healthy gut organisms. So things like antibiotics. An overuse of antibiotics, and actually any antibiotic, will cause dysbiosis. It disrupts your gut microbiome from pill number one. And it doesn't differentiate between good bacteria and bad bacteria. It throws off your pH balance in your gut. Diets high in carbs and sugars. So I preach to my patients all the time. People will argue with me about carbohydrates. Well, we need healthy carbs. You know, we need fruits, we need vegetables, we need all of these things. And yes, to a degree we do, but not in the amount that everybody thinks that we do. And I even beg to differ, like exactly on how much fruit we actually need too. Because the fruits that we're eating are not the fruits that our ancestors used to eat. I can tell you that right now. They're a lot more sweet. They're GMO. They were designed to have more sugar content and less nutrients than what they did a long, long time ago. All carbohydrates break down to sugar, period, end of story. People will argue with me all the time about this. If you are a diabetic, the first thing that I'm going to tell you to do as a diabetic is cut out your carbs. Why? Because that will raise your blood sugar, insulin issues, and inflammatory responses. So we got to cut out the carbs and the sugars. These will feed bad bacteria and candida. And this is one of the things that I was actually talking to them about at that conference that I went to, that health talk about, you know, fixing the gut. And I said, okay, well, what about decreasing your carbs? They agreed with me. Oh, yeah, decreasing the carbs makes a huge difference, but people don't want to do it. Why? Because most people are addicted to carbohydrates. So it's much easier to give a person a pill than to get them to change their diet. So typically, most patients, I recommend more of a keto type diet, or at least definitely under 75 grams of carbs a day. Usually, most people do really well with about 60. Keto is less than a total of 50 grams of carbs per day. And if you're going to have carbs, then I usually recommend grain free. So getting rid of rice, getting rid of wheat, getting rid of rye, oats, corn, things like that. That causes a lot of inflammation within the body. If you are going to have any wheat, usually imported from Europe is better because they don't use glyphosates and things like that, and they're usually non-GMO. But even then, I recommend in smaller amounts. For dental hygiene, okay, all of our health actually starts within the mouth. We have an oral microbiome too, not just a gut, but our oral microbiome. The quality of our saliva is so important for breaking down foods for our immune system. There are certain enzymes in our saliva that help to break down toxins, virus, bacteria. Digestion starts in the mouth. If we have poor oral hygiene, if we have an imbalance in our mouth, and that's a whole other topic. And actually, I might see if I can do a webinar with a holistic dentist on this, but that's a whole other topic. So the oral microbiome needs to be really, really strong for us to be able to start breaking down food properly so it doesn't put as much pressure on our gut, and then our gut can assimilate and use the nutrients and break down the rest of the food with ease. So again, diets high in sugar and carbohydrates. So do you really have that gritty feeling taste, you know, along your teeth? Have you ever felt like that gritty taste or like that grittiness around your teeth? When do you usually have that? Typically, we get that gritty feeling around our teeth when we've had sugar, when we've had a lot of carbohydrates, but you don't get it so much when you're eating meats and proteins because it doesn't stick to your teeth. It doesn't break down your teeth. It doesn't, you know, adhere as much. So having diets higher in proteins and healthy fats and less in carbohydrates is actually really good for dental health and dental hygiene too. Some other things that can actually cause, and I didn't talk about this, is hormone replacement therapy, okay, such and birth control. These things can also cause an imbalance in your pH levels. So a lot of women will turn around and take birth control. But what happens? You're more prone to yeast infections when you're on birth control. Why? Because it throws off your pH balance. So when you throw off your pH balance, you're throwing off your gut, which actually can affect so many different things. As I mentioned before, hormones, your immune system, your overall gut health, how you digest and use your food, how well you absorb nutrients from your food. So birth control is actually not as good. Yes, it prevents pregnancy, but it causes a whole bunch of other issues too, and can lead to a lot of mental health. And then not only that, but now you're turning around and adding in synthetic hormones. And this can actually is a chemical, can throw off your regular hormones, cause organ dysfunction, thyroid, adrenal gland, and many other issues too. And a lot of women can develop, anxiety, depression, and other things because of these artificial hormones. So not my first recommendation at all. Other things that can cause gut microbiome imbalances is stress and anxiety. So yes, if your gut is off balance, then it can cause a disruption between anxiety and mental health. But if you're under a lot of stress from outside factors, a lot of stress, lots of anxiety, how many times, like right before you're ready to do a performance, or if you ever have to give a speech, or if you ever have to talk, you know, um, in front of somebody, or you're in a competition, has your gut ever gotten a little bit nauseated? Some people have gotten so stressed out or so anxious that they've thrown up because it's the gut brain balance. So the gut can affect the brain can affect the gut. So a lot of people hold a lot of emotions in their gut. And we know this with Chinese medicine. Okay, so traditional Chinese medicine. So the gut can hold, so the liver is part of your gut. The liver can hold on to emotions such as irritability, anger, frustration. Your stomach can hold on to things like anxiety, worry. So the stress and anxiety not only affects your gut, but also can affect your immune system as well. So they actually have proven that a lot of stress and anxiety also lowers your immune system, which then also affects the gut. It's like a vicious cycle. So we got to stop it somewhere and we got to find out what's going on. The other thing that can affect gut is toxins, pesticides, and heavy chemicals. Loaded, even it's found in our non-organic food, but in the United States, it's also found in our organic food. So organic in the US does not mean it's not pesticide and toxin free. It's just less toxic because unfortunately we have chemtrails. You see all those like little lovely lines up and down in the sky. Those are not normal clouds. Those are chemtrails. We're being sprayed with it nonstop. That gets into our soil, that gets into the air. So even our organic is not truly organic anymore. And you can have one field, so one farmer is organic, but the guy right next to him might not be organic. So he's spraying a whole bunch of pesticides, which the wind blows and it gets into organic. So it's a mess. Then we have aluminum. Okay, so aluminum and other toxins, so heavy metals and heavy chemicals, these can all cause a lot of issues. So aluminum, I'm just going to name a couple of them, has been shown to cause gut microbiota imbalance. It's also been linked to IBD, irritable bowel disease. So things like aluminum cans. So if you're drinking from an aluminum can all the time, it can get into whatever you're drinking. It's found in antiperspirants, dental composites. Okay, so think of your silver fillings or even your like dental bridges and things like that. Antacids, so your Tums, Rolaids, it's in paints. So if you like to paint, or you're painting the wall or whatever, or your house, it's in paints. It's in cookware, aluminum cookware. Okay. And again, I think I said antiperspirants, but like think of deodorants and stuff like that. Not only does it cause gut issues, but it can lead to things like breast cancer. Okay, especially with antiperspirants. food dyes, such as red dye number 40. Okay, so seen in your cereals, your M&Ms, your Skittles, your candies, your throat lozenges, your NyQuil, the red cherry NyQuil flavor that has red dye, in medications, over the counter stuff. This red dye is so toxic. It's been linked to ADD, ADHD type symptoms, colon cancer, colitis, inflammatory bowel disease. So not good stuff. So we got to be very, very careful with what we're putting into our body and ingesting. So I had somebody that I was talking to earlier today, and they're trying to be cleaner, and I have to commend them, and this takes time to work on. They were using, I think, tie-free and gentle or something, thinking that it was a safe choice. One of the first ingredients, so we looked up the ingredients together, and I can't even pronounce it. I'm not even going to try. So, but we researched the side effects from this. One of the first things was skin irritation, and it was a known carcinogen. And yet it's in our laundry detergent, which goes right on your skin. So your fabrics soak all this up. And then when you sweat, when you wear this, your skin is one of your biggest porous organs. So whatever you put on your skin gets absorbed right through your skin, right into your bloodstream. And a lot of these things can cause gut issues, cancer, skin irritation, and so many things. So we have to be very, very mindful of what we're putting in. Don't just read labels, but read the ingredient list. Okay. So fun times, right? So now that I'm the doom and gloom of everything else, so what can we do? Well, one of the things that I want to point out in how we can find out how good our gut microbiome is and how healthy is our gut microbiome, because as you can see, this leads to a lot of other long-term issues. So we have to start with the gut. All right. Our gut is our overall, health. So this is where the Blu Poo challenge comes in. We want to find out, well, how healthy actually is your gut? Okay. So the Blu Poo challenge, the Blu Poo gut transit time tracker. All right. So it is a supplement, and they actually take blue spirulina and it dyes your poop blue. All right. So it dyes the food, which then will dye your poop. This will give us really, really good insight to your digestion process, nutrient absorption, fiber metabolism, and overall health of your gut microbiome. All right. This is from a company from Systemic Formulas and Alimentum Labs. It is a company that I completely trust and I use with my patients. To order this, okay, so what you will need to do, to purchase the Blu Poo tracker, it's $24, and you will scan the QR code, okay, and then you will have it shipped out to your house. You will once you put it in your mouth, then you will note the time that you take it, the day, and then you will note the time that you start seeing your poo turn blue. You're going to write down how many hours in between and keep hold of that. So you're going to keep a track of that. And then you're going to keep a journal of what foods you've been eating. And then you're going to sign up for the next webinar to decode what your gut is telling you. It's that easy. So our next webinar is going to be in 2 weeks. Okay, so it will take about 1 full week for you to get the Blu Poo tracker. Okay, and you want to order it right away, so that way you have time between now and then to take it, to track down what you're doing as far as your eating, and then you're going to sign up for the next webinar. The next webinar is going to be 2 weeks from today at 8 p.m. And it's going to be roughly about an hour, give or take a little bit. And obviously you can do this right from your home on Zoom. And you're going to register by scanning the QR code for the next webinar. Okay, does anybody have any questions? We're going to open this for discussion, and I am actually going to, hang on, let me stop this. And let me see if I can stop Facebook. Okay.